As a physician who spent years studying the intricate balance between human physiology and peak performance, I want to introduce you to one of the most powerful and underutilized approaches in male health optimization today: sublingual delivery of natural performance-enhancing compounds. Now, this isn't about gimmicks or quick fixes. What I'm about to share with you is deeply rooted in pharmacology, human anatomy, and clinical science. Sublingual administration, placing active substances under the tongue where they're absorbed directly into the bloodstream, has been used in medicine for decades when rapid action is medically necessary. What's remarkable is how this method, already trusted in emergency and cardiovascular medicine, is now being leveraged for precision performance enhancement, particularly in the area of male function. Clinical observations and user experiences suggest that with proper application, certain naturally occurring compounds can take effect in as little as 10 to 15 minutes, and the improvements, whether in stamina, vascular response, or overall readiness, can be both measurable and profound. Now, why sublingual delivery works so well? The reason sublingual delivery is so effective lies in its ability to bypass the digestive tract and liver, avoiding what's known as first-pass metabolism. In standard oral ingestion, active compounds are often broken down by stomach acids and liver enzymes, reducing their potency before they ever reach systemic circulation. In contrast, compounds administered under the tongue are absorbed through the thin, vascular-rich mucosa and enter the bloodstream almost immediately. This not only increases the speed of effect, but also enhances the bioavailability, the actual usable dose that your body receives. Let's begin with L-arginine, an amino acid that serves as a direct precursor to nitric oxide, NO, a critical signaling molecule that governs vasodilation, or the widening of blood vessels. Nitric oxide improves blood flow, oxygen delivery, and responsiveness, key components in both athletic and intimate performance. However, when consumed in pill or capsule form, a significant proportion of arginine gets degraded in the gut and liver, leaving only a fraction to reach target tissues. When administered sublingually in powdered form, typically in doses of 500 to 1,000 milligrams, the absorption is almost immediate, and nitric oxide production ramps up within 15 to 20 minutes. This allows for well-timed, highly effective vascular support before moments of high performance. Hold the powder under your tongue for 3 to 5 minutes. Allow it to fully dissolve and avoid swallowing prematurely. This window of time allows active compounds to pass through the mucous membrane and enter circulation with minimal loss. Now, why sublingual delivery works so well? The reason sublingual delivery is so effective lies in its ability to bypass the digestive tract and liver, avoiding what's known as first-pass metabolism. In standard oral ingestion, active compounds are often broken down by stomach acids and liver enzymes, reducing their potency before they ever reach systemic circulation. In contrast, compounds administered under the tongue are absorbed through the thin, vascular-rich mucosa and enter the bloodstream almost immediately. This not only increases the speed of effect, but also enhances the bioavailability, the actual usable dose that your body receives. Next, we have L-citrulline. Unlike arginine, citrulline is not used directly to create nitric oxide, but is converted to arginine by your kidneys. Interestingly, this indirect route often results in higher and more sustained blood arginine levels compared to taking arginine alone, a finding supported by multiple clinical trials published within the last 5 years. When used sublingually, 1,000 to 2,000 milligrams of citrulline powder offers both immediate and lasting vasodilatory support. Thanks to its metabolic conversion process and efficient uptake, citrulline provides a smoother, more prolonged increase in nitric oxide, supporting performance over longer durations. For optimal results, take it 30 to 45 minutes prior to physical or intimate activities. Where the science becomes particularly compelling is in combination protocols. By blending L-arginine and L-citrulline, you're stimulating nitric oxide production through two separate biochemical pathways, maximizing effectiveness while reducing performance variability. To further enhance bioavailability, one can add piperine, the active compound found in black pepper. Piperine has been shown to increase absorption not just in the digestive tract, but also through mucosal membranes by downregulating liver enzymes that normally break down active substances. A common and well-tolerated blend may include 500 milligrams of L-arginine, 1,000 milligrams of L-citrulline, and 5 milligrams of piperine. Combine, mix thoroughly, and take sublingually for 3 to 5 minutes, usually 20 to 30 minutes before activity. This triple action formula supports robust, multi-pathway nitric oxide production and rapid physiological readiness. Let's turn to niacin, or vitamin B3, known for its ability to produce full-body vasodilation. Niacin works differently. It doesn't directly produce nitric oxide, but it causes relaxation of vascular smooth muscle, increasing blood flow across the board. The characteristic niacin flush, a warm, tingling, reddened skin sensation, is not merely a side effect, it's a visible sign of significant vascular widening. Niacin's flush-inducing effects occur within 10 to 20 minutes following sublingual usage, making it a rapid tool for enhancing tissue oxygenation. Use 25 to 100 milligrams of immediate-release niacin powder, adjusting the dose based on your personal tolerance. Begin conservatively to minimize discomfort. For those who struggle with the flush sensation, sustained-release niacin taken daily may offer long-term vascular benefits without the acute effects. Beetroot powder is another exceptional nitric oxide booster, but it works through an entirely different mechanism. Rich in dietary nitrates, beetroot enhances nitric oxide via enzymatic reactions in the saliva and blood, making it especially effective for sublingual application. Use 1 to 2 grams of high-quality organic beetroot powder. Hold beneath the tongue for several minutes, and you'll begin to feel a boost in endurance and vascular responsiveness about 30 to 60 minutes post-administration. This makes beetroot an excellent synergist with arginine and citrulline, covering both the nitrate and arginine pathways for a holistic approach. Pine bark extract, often standardized to contain at least 95% proanthocyanidins, helps preserve nitric oxide by inhibiting enzymes that break it down. It also improves endothelial function and has been clinically associated with improved erectile function and vascular performance. To utilize its sublingual potential, use 100 to 200 milligrams, ideally 20 to 30 minutes prior to expected activity. When absorbed through the oral mucosa, these phytonutrients act quickly, enhancing not only nitric oxide availability, but also vascular elasticity. Derived from traditional Chinese medicine, horny goatweed offers a compound called icarin, known for its mild PDE5 inhibition, a mechanism similar to that of prescription medications like sildenafil, although far gentler and without the pharmaceutical side effects. When used in a standardized extract with 20% or higher icarin content, place 300 to 500 milligrams under the tongue and hold for 3 to 5 minutes before swallowing. Effects generally begin within 30 to 45 minutes, supporting blood flow and vascular tone through enzymatic modulation. Technique matters. Proper sublingual technique is critical. Ensure your mouth is clean and avoid eating or drinking immediately before use. Gently move dissolved compounds under the tongue to increase surface contact. Hold the compounds for at least 3 to 5 minutes to allow full absorption. Don't rush the process. Swallowing too soon limits efficacy. Some users prefer to swallow the residual. Others may spit it out if the taste is unpleasant. Your choice, but full ingestion maximizes effects. For optimal results, combine sublingual supplementation with strategic lifestyle practices. 60 minutes before. Hydrate well with mineral-rich water. 30 minutes before. Administer your chosen sublingual formula. 20 minutes before. Engage in light movement or stretching to boost blood circulation. 10 minutes before. Practice deep breathing or mindfulness to activate the parasympathetic nervous system and reduce psychological tension. This integrative routine amplifies not just physical readiness, but psychological confidence, an essential factor in performance. Purity is paramount. Always source pharmaceutical-grade or food-grade powders, preferably with certificates of analysis verifying heavy metal-free, contaminant-free status. Avoid any product containing binders, fillers, or artificial flavorings. Store your powders in airtight, light-resistant containers in a cool, dry environment. Proper handling ensures stability for 12 months or longer and maintains potency. Acute benefits, such as increased readiness, stamina, or response, can typically be observed within 15 to 45 minutes, depending on the compound. Peak performance tends to occur between 30 and 60 minutes post-administration. With regular use, daily or several times a week, many men report baseline improvements in vascular health, endurance, and overall confidence within 2 to 4 weeks. These protocols are generally safe, but take care. Start with lower dosages to evaluate individual sensitivity. Use caution if you have low blood pressure or are taking medications, particularly blood thinners. Niacin can cause transient flushing. Avoid high doses on your first use. Always consult a healthcare provider before introducing new supplements if you're managing any chronic condition. High-quality bulk powders are incredibly cost-efficient, often costing just a few cents per dose. This stands in stark contrast to branded supplements or tablets that may run several dollars per serving. The DIY approach allows you to customize your formulas to suit your physiological needs and personal preferences. Sublingual supplementation is not a cure-all, nor should it be. But when integrated into a comprehensive male health strategy, it becomes a powerful tool to amplify your performance capacity, quickly, safely, and effectively. These targeted interventions should always be supported by foundational health practices, nutrient-rich diet, regular cardiovascular training, strength and flexibility work, stress resilience strategies, and high-quality sleep. Together, they create a system of support for optimal hormonal function, endothelial integrity, and overall vitality. And perhaps most importantly, having a reliable performance protocol boosts psychological confidence, contributing greatly to outcome success. When the mind feels secure, the body often follows with excellence. I'm Dr. Samra Tarajalik, and I hope this exploration has equipped you with practical, science-backed tools to take control of your performance when it matters most. If you found this valuable, I invite you to subscribe and stay connected for more evidence-based strategies to sharpen your health, energy, and vitality, naturally and effectively. Until next time, remember, results don't always require delay. Sometimes the best outcomes come from the fastest and most direct route.